So anxiety disorder is also one of the most common disorders we have. In fact, epidemiological studies shows that it is the most common psychiatric condition in the population here in the United States. And the issue with anxiety disorder is that most people live with that and they don't get any treatment and don't do anything about it. Because they think this is normal, this is the way they should be, but the thing is that this is not. This can be easily fixed, and the treatment is very, very effective. You have both kind of treatment, both kind of therapies, including the psychopharmacological treatment versus many therapies like CBT or psychodynamic therapy is very effective for anxiety disorders. And in fact, studies show that the therapy is much more effective than depression as such. When you have a clear-cut diagnosis of anxiety disorders, and many anxiety disorders are problems at times, particularly like social anxiety disorder, obsessive-compulsive disorder, which often people get into the treatment because of those are such a disabling condition. But generalized anxiety disorder, panic disorder, phobias, we see all of them, and including in children, and often these poses many challenges. 1/3 of ADHD children have anxiety disorders. It's just a common comorbidity with ADHD, and what happens with the pediatrician when they treat these kids with ADHD with stimulation, with stimulants, the anxiety gets worse. And often we get a patient who says, oh, my child was given Ritalin or Adderall or something, and he had a really bad reaction to it, and he started throwing up, or he really had a panic attack, and he had to be sent home from the school. And then when we take the thorough history and do an evaluation, we determine that the child also suffers from many kind of anxiety. If you treat the anxiety disorders, you can very well tolerate stimulants, and you can really get benefit with them. But you have to really fix that problem first, and do other type of evaluation to determine that if there is another issue or not. I just wanted to emphasize that these treatments are very safe with anxiety. You don't have the side effect which we think about medications. SSRIs are one of the safest medications to take, and they are out there for almost 35 years in the market, and long-term studies have shown no major side effects, such as with many other psychiatric or even medical medications we have, including hypertension, including other medications we take over the counter like Tylenol or ibuprofen. They have much more side effects than SSRIs. And they're blamed because there's a stigma associated with it, and people often criticize and discriminate with mental health issues. But the treatment is just very, very effective, if not less than any medical